Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study from the field of veterinary internal medicine, exploring the challenges of diagnosing a serious condition in our canine companions, cerebrovascular accidents, more commonly known as strokes. When a dog suddenly exhibits neurological signs, such as weakness, incoordination, or changes in behavior, it can be a distressing experience for owners and a diagnostic puzzle for veterinarians. Currently, the most reliable method for diagnosing strokes in dogs involves advanced imaging techniques, particularly magnetic resonance imaging of the brain. This technology allows veterinarians to visualize the intricate structures of the brain and identify abnormalities consistent with a stroke, whether it be due to a blockage of blood flow, known as an ischemic stroke, or bleeding within the brain, a hemorrhagic stroke. Magnetic resonance imaging provides detailed images that can help pinpoint the location and nature of the damage. However, there are limitations to relying solely on magnetic resonance imaging. Firstly, this technology is not always readily available to all veterinary practices due to the significant investment and specialized expertise required. Secondly, even when magnetic resonance imaging is performed, the appearance of a stroke on the images can sometimes resemble other conditions affecting the brain, such as inflammation of the brain and its linings or the presence of tumors. This overlap in imaging characteristics can make it challenging to definitively diagnose a stroke and differentiate it from other serious neurological diseases. In human medicine, alongside advanced imaging, doctors often utilize blood tests like the D-dimer concentration and a test called Thromboelastography to help support the diagnosis of strokes. D-dimers are measurable substances in the blood that become elevated when the body has formed a blood clot and then broken it down. Thromboelastography, on the other hand, assesses the overall clotting ability of the blood, looking at how quickly a clot forms, how strong it becomes, and how it breaks down. These blood tests can provide additional clues that, when combined with imaging findings and the patient's clinical signs, can aid in reaching a more confident diagnosis in human stroke cases. Given the challenges in diagnosing canine strokes with magnetic resonance imaging alone, and the utility of D-dimer and thromboelastography in human medicine, researchers in veterinary medicine sought to investigate whether these blood tests could also be valuable tools in supporting the diagnosis of strokes in dogs. The primary goal of this research was to evaluate the sensitivity and specificity of blood D-dimer concentration and thromboelastography in dogs that had already undergone magnetic resonance imaging for suspected neurological issues. Sensitivity refers to how well a test can correctly identify dogs that actually have a stroke, while specificity refers to how well a test can correctly identify dogs that do not have a stroke. A secondary aim of the study was to determine if these blood tests could help distinguish between the two main types of strokes in dogs, ischemic and hemorrhagic. The researchers hypothesized that dogs diagnosed with a stroke would be more likely to have abnormal results on these blood tests, particularly in cases of ischemic stroke. To conduct this investigation, a retrospective study was carried out, examining the medical records of 68 client-owned dogs that presented with neurological signs and had undergone brain magnetic resonance imaging, as well as either D-dimer concentration testing or thromboelastography, or both. The study took place across 2 veterinary teaching hospitals between August 2015 and May 2021. The researchers carefully defined the criteria for including dogs in the study, ensuring that all dogs had a thorough neurological evaluation and a complete magnetic resonance imaging study of the brain. Based on the magnetic resonance imaging findings, the dogs were divided into 2 main groups, one group diagnosed with a presumptive stroke, either ischemic or hemorrhagic, and a control group diagnosed with other neurological conditions. The imaging criteria for a suspected ischemic stroke included the presence of a specific type of lesion on the magnetic resonance images, characterized by certain patterns of brightness and darkness on different image sequences. For a suspected hemorrhagic stroke, the criteria included the presence of evidence of bleeding on specific magnetic resonance imaging sequences. The control group consisted of dogs with various other neurological diseases, such as inflammation of the brain, tumors, or idiopathic epilepsy. The researchers then compared the results of the D-dimer concentration tests and the thromboelastography tests between the stroke group and the control group. They also looked at whether abnormal blood test results were more common in dogs with ischemic strokes compared to those with hemorrhagic strokes. Now, let's delve into the findings of this study. A total of 68 dogs met the criteria for inclusion. 40 of these dogs were diagnosed with a stroke based on their magnetic resonance imaging and neurological signs, while 28 dogs formed the neurologic control group, having other confirmed neurological conditions. 35 dogs had their blood D-dimer concentrations measured, and 34 dogs underwent thromboelastography. Interestingly, only one dog had both tests performed. When looking at the D-dimer results, the researchers found that an elevated D-dimer concentration was not significantly associated with having a stroke. Among the 13 dogs diagnosed with a stroke in the D-dimer testing group, only 4 dogs had an increased D-dimer level. In the control group of 22 dogs, 3 dogs also had elevated D-dimer concentrations. This resulted in a sensitivity of the D-dimer test for diagnosing stroke of only about 31%, meaning it only correctly identified about 1/3 of the dogs that actually had a stroke. However, the specificity of the D-dimer test was relatively high, at about 86%, indicating that it was fairly good at correctly identifying dogs that did not have a stroke. Importantly, the researchers also found that an abnormal D-dimer concentration was not helpful in distinguishing between ischemic and hemorrhagic strokes. Moving on to the thromboelastography results, the study included 34 dogs that underwent this blood clotting assessment. In this group, 28 dogs had a diagnosis of stroke. The researchers focused on results indicative of a hypercoagulable state, meaning the blood had a tendency to clot more readily, as none of the dogs showed results consistent with hypocoagulability, a reduced ability to clot. They found that an abnormal thromboelastography result, suggesting hypercoagulability, was also not significantly associated with a diagnosis of stroke. Among the 28 dogs with stroke in the thromboelastography group, 18 dogs had abnormal results. In the control group of 6 dogs, 2 dogs had abnormal thromboelastography results. This yielded a sensitivity of the thromboelastography test for stroke diagnosis of about 64% and a specificity of about 67%. Similar to the D-dimer results, thromboelastography was also not effective in differentiating between ischemic and hemorrhagic strokes. The researchers noted a difference in the populations of dogs that underwent D-dimer testing compared to thromboelastography. The group that had D-dimer testing had a lower prevalence of stroke, about 37%, compared to the group that had thromboelastography, about 82%. Additionally, in the thromboelastography group, dogs with strokes were significantly more likely to have had the blood tests and the magnetic resonance imaging performed within 7 days of the onset of their clinical signs. Now, let's consider the implications of these findings in the discussion of the study. The researchers concluded that neither blood D-dimer concentration nor thromboelastography, when used alone, is a reliable diagnostic test for confirming strokes in dogs with neurological disease. However, they noted that a positive D-dimer result in a dog with neurological signs could still be a valuable piece of information, particularly in a population where the overall likelihood of stroke is low. Due to its relatively high specificity in this study, a positive D-dimer might suggest a higher suspicion for a stroke and warrant further investigation, such as pursuing magnetic resonance imaging. The findings of this study contrast somewhat with the use of D-dimer in human medicine, where it often demonstrates high sensitivity and a good ability to help rule out blood clots in certain situations. However, the researchers pointed out that previous veterinary studies have also shown limitations in the reliability of blood D-dimer for diagnosing canine strokes. They suggested that the timing of the blood draw relative to the onset of clinical signs is unlikely to have significantly impacted their results, as D-dimer levels can remain elevated for a considerable period after a stroke in humans. The study did not evaluate D-dimer concentrations in the cerebrospinal fluid, the fluid surrounding the brain and spinal cord, which has been explored in both human and veterinary medicine for neurological conditions. The researchers focused on blood D-dimer because blood sampling is less invasive than collecting cerebrospinal fluid and does not require anesthesia. Regarding thromboelastography, while human studies have indicated that changes in blood clotting properties consistent with hypercoagulability might be seen in patients with ischemic strokes and could even have some predictive value in distinguishing stroke types, this was not observed in this study of dogs. In fact, they were unable to assess for an association between hemorrhagic strokes and a reduced ability to clot because none of the dogs in their study showed thromboelastography results indicative of hypocoagulability. The researchers also did not evaluate how thromboelastography results might change in response to treatments for stroke in dogs. Unlike in human medicine, a state of increased blood clotting based on thromboelastography did not help differentiate between ischemic and hemorrhagic strokes in the dogs studied. The researchers acknowledge that both D-dimer and thromboelastography have been investigated in veterinary medicine primarily in the context of systemic diseases and other types of blood clot-related conditions, rather than specifically for strokes. Both D-dimer and thromboelastography can be influenced by various underlying health issues, such as other blood clots in the body, widespread inflammation, or certain diseases like cancer. While the dogs in this study were presented for neurological signs, the researchers could not entirely rule out the potential influence of other ongoing systemic diseases on the blood test results. One interesting observation was the higher number of hemorrhagic strokes compared to ischemic strokes in the thromboelastography group, which is not typical in dogs. The researchers suspected this might be due to the inclusion of dogs with cerebral microbleeds, very small areas of bleeding in the brain, in the hemorrhagic stroke category. While sometimes considered an incidental finding, microbleeds have been associated with other neurological signs and outcomes in dogs. In human medicine, microbleeds are linked to small vessel disease in the brain and can be a risk factor for both hemorrhagic and ischemic strokes. The study also noted that cerebrospinal fluid analysis, another diagnostic tool for neurological diseases, was not consistently performed in all dogs and was not a requirement for inclusion in the study. Previous research has shown that cerebrospinal fluid findings in dogs with strokes can be variable, ranging from normal to showing increased protein levels or a mild increase in inflammatory cells. The findings in this study regarding cerebrospinal fluid were generally consistent with these prior reports. The researchers highlighted several limitations of their study. Its retrospective nature means they were looking back at existing records, which can sometimes have missing information or inconsistencies. The fact that the D-dimer and thromboelastography tests were performed in different populations of dogs with different stroke prevalences makes direct comparison between the tests challenging. The sample size, particularly in the control group for thromboelastography, was relatively small. Furthermore, only one dog had both tests performed, limiting the ability to assess their combined utility. The timing of the blood tests in relation to the onset of neurological signs varied among the dogs, which could have influenced the results. Importantly, none of the diagnoses were confirmed by histopathology, the microscopic examination of brain tissue, which is the definitive way to diagnose a stroke. The criteria for including dogs in the study may have also led to a selection of more severely affected animals, potentially not fully representing the broader population of dogs with strokes. Finally, the control group consisted of dogs with other neurological diseases, and it is possible that these underlying conditions could have affected the D-dimer or thromboelastography results. In conclusion, this study suggests that while blood D-dimer concentration and thromboelastography alone are not reliable for definitively diagnosing strokes in dogs, a positive D-dimer result might serve as a reason to pursue further, more specific diagnostic testing, especially when the initial suspicion for stroke is not very high. The researchers recommend future prospective studies that would evaluate magnetic resonance imaging, thromboelastography, and D-dimer concentrations in both blood and cerebrospinal fluid in dogs suspected of having a stroke. The ultimate goal is to identify better diagnostic tools, or biomarkers, that can improve the accuracy of stroke diagnosis in veterinary patients and provide alternatives when advanced imaging is not feasible. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.